Aloha and good afternoon. My name is Jürgen Steinmetz. I'm joining you from livestream.travel and eTurboNews in Honolulu. And together today we're also broadcasting for Hawaii News Online. I'm wanted you to listen to a number of recordings. These are phone calls with elected officials, and all of these elected officials I talked to are senators or representatives of the health and disaster management committees by the state of Hawaii. So you would think that any of these senators or representative would know how COVID cases are counted, specifically when it comes to the travel and tourism industry and with visitors to the state of Hawaii. The visitor industry obviously is one of our most important industries in this state. There's also a short phone call with the Hawaii Lodging and Tourism Organization, and they also kind of hiddenly explain what is best said actually at the end of this recording by the representative for Senator Sharon Morivaki in explaining that yes, if a visitor falls ill with COVID or is tested positive with COVID, this visitor will immediately be counted in Hawaii. But after a short investigation, these numbers initially added to the Hawaii count will then be adjusted and added to their home state or home country's count. So that's really where we stand. We don't know how many visitors actually have COVID, and this seems to be a number that is deliberately hidden from the public, from the visitors, to make our state perhaps appear to be a lot safer than it really is, and make our residents feel a lot safer. There's no guarantee. Maybe none of our visitors have COVID. Wait a minute, not true. Actually, if you listen to the recording, you see that they actually admitted there are visitors with COVID and numbers have been adjusted. So listen to what our state representatives and state senators have to say, and then you can come to your own conclusion.
Um, okay, so let's break down your question because off the top, based on what you said so far, I would typically refer you to the Department of Health, but you sound like someone who might have reached out to them already.
I did. I reached out to the Department of Health, I reached out to the governor's office, and I reached out to every member of the health committee. And then I run into that there's a pandemic disaster preparedness committee. I didn't even know. And so I wanted to clarify from what I understand so far, the head, as I said, the head from the health committee is that these numbers are not included. So if someone from California happens to get sick here, he would be counted in California. Is that what you understand as well?
Um, okay, so speaking for myself on as far as what I know the state's counting mechanisms have been, uh, the state of Hawaii would not count that person as a Hawaii number. I don't know what California is doing.
Right.
So just
No, I'm
because
not.
Hawaii doesn't count them doesn't mean California is counting them.
I understand that. Yes, I
Okay.
understand that.
Okay.
But there are certain guidelines. The United States is part of the World Health Organization, so they have to be counted somewhere. That's an international agreement we're
Yeah,
part of.
if I had to working on an assumption, I would say yes, California would count them because they would
Right.
be a resident of California.
Makes sense. Yeah.
Yeah.
Okay. But is this the understanding then from your from is it Congresswoman, right? Ichiyama,
No, just state representative. Yeah,
state representative.
she
I'm
does
sorry.
not go
Yes.
to Washington D.C. No.
No, I'm sorry. Sorry, my mistake. State representative. Yes. Okay, so that's her understanding then.
Yeah. So the state of Hawaii is counting Hawaii residents that are in and out of state. So like what that could mean is like if someone owns a home in Las Vegas, for example, and they contract the virus in Las Vegas in Nevada, that count is still counted in Hawaii numbers.
Right, I understand. So if this was the case, I'm also maybe should disclose to you, I'm chairman of a global organization, what is the World Tourism Network. We're an organization in 127 countries, including the United States, and we deal with nothing but COVID right now
Mhm.
and for the last year. So we also are the ones behind the rebuilding.travel discussion. Now, when I'm looking at these numbers, and then as a Hawaii resident on top of it, shouldn't I be concerned that the state is hiding or these numbers from other residents? Because we don't know what the dark number is of tourists, even though I understand there are strict requirements for testing and so forth, but that's not a guarantee, and numbers can change within an hour after testing. So there is definitely most likely a number of people that get here and have COVID regardless, right? And some of them may never know, and we may never know. But if it's known, um, how high is this dark number and why is it hidden um, in your statistics? Because it becomes a matter of safety and security. In this case, it becomes a matter of death and life. And so I'm very confused. So the if Mrs. Ichiyama is in charge of a disaster preparedness, if I was in her position, this would be an enormous important concern, wouldn't it?
I don't speak on behalf of the rep, so I cannot answer that question.
Yeah, so maybe you can ask the rep because I'm calling the rep's office.
Yes,
And
no,
it
I
would
understand.
definitely be interesting to know.
Okay, so let me so just I'm rephrasing what I think I'm hearing. So the heart of your question is the state of Hawaii tracking who either enters the state with the virus or who is a visitor but contracts the virus while in the state? And do they have that number? And if that number is not released, why is it not released? Is that the meat of what you're asking?
Yeah, I'm sure it's released someplace, but it's not released publicly. So we're talking about transparency of government, and we're talking about the safety and security perception. Right now, Hawaii is seen as a safe destination, despite now record domestic visitors numbers. Our numbers here, luckily, are quite low. But are they really that low? Because if we don't know what the visitors count is among these numbers, we have no idea what these numbers are. So that puts us in a, I would say, in a very difficult position to, to promote Hawaii and say Hawaii is a safe destination because we simply don't know. So that's my concern.
Well,
So as a resident, my second concern is as someone who lives here,
it's
should I
not
be
that it's
relaxed?
not that we don't know. It's not that we don't know. Your problem is that you don't know, right?
I don't know, or anyone. Also, if I was a visitor and I make a decision whether I wanted to travel to Cancun, if I want to travel, or to Florida, or to Hawaii, these days people are looking at the numbers. Okay, how safe is my destination? Hawaii is seen, and I believe it is, one of the safest domestic destinations to travel to. But why would we not disclose? I mean, there is an obligation of transparency in government. Why are we hiding these numbers? Is it because of business concerns? Is it because hotels are pushing us not to release these numbers? I'm confused.
Well, I hear your question, and I'm going to relay it to the representative. But like there's an assumption on your part that the state is being deceitful.
Yes,
Now,
there
you
is.
might be right, you might be not right. I don't know. That's not my job to know, but that's you are assuming that on your part in asking that question.
Yes, I
Can
am,
we agree?
according to the response. And not only your response, I reached out, I can tell you, to every member of the House committee from the House and Senate. And I've never seen so much confusion of different
Mm.
responses for the same question. It's a very simple question. I also reached out to the Department of Health and to the governor's office and to all mayor's office. And I
Okay,
can tell
well,
you,
let
I
me
have a,
on behalf of my colleagues at the state capitol, when you call someone like me, I am not a health expert and I am not the legislator. We manage their office.
I
So
understand.
I can forward your question and I can answer your questions based on things that are, of general knowledge to the people of Hawaii. So that I can forward your question to the representative, but I'm also trying to make sure that I'm getting the factual question correct and that what I am going to share with her honestly reflects what the information you are seeking, but I also want to set an expectation with you that the information I'll be available to find is what someone like me is able to find. I don't work for the Department of Health director. You know what I mean?
No, no, and I fully understand that. I'm not calling you personally. I don't know who you are. I'm calling the business number for Senator Ichiyama, who is an elected official and is head of a
Right,
committee.
right,
So that's what I'm
right,
calling, and that's the answer I like to get. Because if
right.
I would assume if I elect an official, that this official then is very familiar with these numbers because this is an essential part of her job, I would think, you know?
Yeah, I would agree to that argument. Yeah.
Okay.
Okay, I will be on the lookout. When I see it, I will flag it for her and bring it to her attention, and
Okay.
and we'll go from there.
I really appreciate it. Thank you so much. Take care.
Yeah, no problem, Mr. Steinmetz. Have a good day. Bye bye.
Bye-bye. Hi, this is Jürgen.
Oh, hi, Jurgen. This is John over at the office of Senator Sam Bonaventura.
Oh, that was quick.
Um,
Thank you so much.
oh yeah, no. Thank you for your question. Yeah, so I'm looking, to look it up. Just we confirmed. They do. So non-residents are counted in the statewide total count, and I think, yeah, and I guess one category they break it down into is travel, non-residents, travel associated, and it makes up about
Okay.
3.5%. But yeah, but it looks like non-residents are included in the statewide totals.
I appreciate it. Thank you so much.
Okay, thank
Take
you.
care.
Okay,
Bye-bye.
take care.
Aloha, Representative Imani's office.
Yes, hi, good morning. My name is Jürgen Steinmetz with ETN. I called you earlier and you responded to my phone call in regards to the count of tourists not being included in our daily COVID count. Is this you who left me this message?
Yes. So that was what we were told from Department of Health.
Okay. Now, see, this is where the confusion is. And I'm sorry, just I tried to reach out to a number of people. Who do you represent? I'm sorry.
We are the chair of Health, Human Services, and Homelessness Committee.
Okay. Now, if you are this, so why is your response 180 degrees conflicting with the response I got from you after I talked to you from the Department of Health Media Relations? I'm really getting confused. If you guys don't know it, who in the hell would know this? You
It
know,
would be
you're an,
Department of Health. This is
okay,
what we
but
were told.
okay.
So
Now, if
we
you
don't do the count. We don't know anything about the count. Our office doesn't take care of that. So all the
okay,
information that we get is from Department of Health.
okay. Now, if you get you probably have a lot better source in the Department of Health than I would have. So let's assume your number is right. Then we have an issue. And that's the next step. If we have an issue, we don't know how many tourists actually have COVID. And if this number is not included, we may be looking at something completely different here than what we're looking at every day, what is misleading every citizen who lives here. And that becomes a political issue again. So, and I like to know what the reasoning behind this, if you were correct with what you're saying, we may have thousands of tourists coming here with COVID, what I don't assume, but it could be, right? We don't know. So how safe are we and how safe is our tourism industry? Now, if you look at similar jurisdictions like the Seychelles, like Cozumel, Mexico, where there's a similar problem, just look it up. You will get the response. So that's something I think you as or your representative as the department, head of the health department should be extremely concerned. But what I'm more concerned of that there is no straight answer. When I talked to 3 different people in our legislator, in our CDC, City of Honolulu, everyone has a different scenario. Why is it so difficult to get a one-time answer and a correct answer? Your answer, I can tell you, is alarming. It's 180% different from answers I received from others. So that's why I'm very concerned.
Okay. I mean, this is what I'm getting. This is what we've gotten from Department of Health. This is back a while back ago. I'm not sure if they changed it. We weren't aware of anything, but I can follow up.
Well, I didn't ask you to change old data. I asked you to change new, current data. And that's what we meant to publish also. Okay, so if I refer to you and you're giving me data or something what was weeks ago or months ago, this is a fast moving situation. That is very confusing, and I would expect as someone an elected official to give me correct information and not assumption. So maybe if you can double check and let me know, I would really appreciate it.
Okay, I'll ask the department to contact you personally.
Okay, thank you. Okay, thank you for your help. I appreciate it.
Thank you. Bye-bye.
Aloha, Senator Kehokalale's office. How may I help you?
Yes, hi, good morning. My name is Jürgen Steinmetz. I'm calling on behalf of the World Tourism Network, and I have reached out to you. I'm also live here in Hawaii, so so I'm voting. But I reached out to you a number of times to get a verification on the numbers from the health department in regards to COVID. And I did get a response now finally from your colleague from the House side, but I wanted to confirm this with you as well. Apparently, the numbers we had been getting from the Department of Health in regards to new COVID infections included residents that are not in Hawaii and are currently out of state. I understand this. So my question was, what about visitors that are in Hawaii and reside in another state? Would they be counted in the other state, or would they be counted in Hawaii?
Oh. Okay. If they contract COVID,
Right.
if they're counted here, or if they're counted out of state.
Their home state, yes.
Okay, is that what
Yeah.
you're asking for?
Yes, because see, we count Hawaii residents that maybe get COVID in California, for example. We count them here. They're not counted in California. So I'm wondering if this is the same way here.
Yeah, normally we'll count it here, but it's also counted in California. If they're visitors coming tourists here, for visitors.
Okay, because according to to Ryan Money's office, I believe, that is the chair for the health committee from the House. According to them, these numbers are not included in our numbers.
Not in Hawaii.
Not in Hawaii.
Yeah.
Is that correct?
Yes.
Okay. Now, if this was correct, what my concern is, isn't the health department misleading everyone in not providing accurate numbers? I understand visitors here need to be vaccinated within 3 days before. What doesn't mean, it means like a 20, maybe 50% accuracy, according to, if you compare data from the World Health Organization, because sometimes you cannot detect it two days before. So they may develop it here without even knowing, depending if they're vaccinated, they may have no symptoms. So we don't know how many people actually have the virus and can give it to residents and other visitors. They're not counted. So isn't the Hawaii Tourism Authority and you guys, as being responsible as an elected official, why are you misleading the people here in Hawaii with these data?
No, I think they take accurate data on everything, which the departments will hold. So they'll know if they come here, if they have COVID, they'll keep the numbers as the visitors come here to Hawaii, but it also has to be noted in wherever they're from, California or Australia or whatever. They'll keep numbers. We have to keep all the data of everything and track it as well. Are you a resident of Kaneohe?
No, I'm in Kaka'ako, but it doesn't really make any difference.
Oh, you're in Kaka'ako. Oh, okay. I have to let your Kaka'ako representative know as well that I spoke to a constituent of theirs, just so that I can. Kaka'ako. Okay.
I reached out to them and there was no response. My concern is.
Okay.
Really, the senator is in charge of the Senate Committee on Health, what includes COVID. So if anyone
Yeah,
would
as
know,
well as the Kaka'ako as well. She's also on the COVID committee too. I think it's Milwaukee, Senator Milwaukee.
okay. Yeah,
Yeah, that's
I'm not,
your senator.
Milwaukee is the co-chair. I see it's Rosalind Baker, and I see a member is Sharon Milwaukee. I can see that.
Yes. So I'll
Yes,
let her know.
yeah,
I'll
but it
let her
doesn't
know
make.
that I spoke to you to let you know um, that I spoke to a constituent who was concerned because normally for us, if there is a constituent that do call us, that's not our constituent, we have to let them know that someone
That's no,
did call so that they don't feel like we're stepping on their toes.
no,
Okay?
no.
And I have
My
your
concern,
number as well, which I'm going to share with the office manager that I spoke to you.
I don't think you have my number. I can give you my number you see
Okay,
on the call.
perfect.
ID is a Zoom number. You cannot call back.
Okay,
Let me
and
give
can I have your name as well?
you. My name is Jürgen,
Your
Juergen,
Juergen.
and my last name is Steinmetz, Steinmette.
Okay,
And,
and you're a citizen. You're here in Hawaii
yes, I
from
am.
Kaka'ako. You're born and raised in Hawaii.
Well, I don't have to be born here, but I lived here for almost 35 years, I guess. So is it
35 years. Okay, good. I just wanted to
just
note that.
being
He's a
born here?
constituent, live here in Hawaii over 35 years. Georgian Steinmeshi? I hope I'm
Steinmetz.
saying that right. Okay. Okay, perfect. I'll just let her know. So at least I have some information to share with their office and
But,
from Kaka'ako.
look, one of the reasons I'm calling, I'm chairman of a global organization. It's called the World Tourism Network.
Chairman, Global. Okay.
And World Tourism WTN.travel. And we do exactly, we work with statistics and data and help destinations in the world to access to the vaccine. It's a discussion we work with the World Health Organization and many more. And
Oh,
I'm
very good. Chairman. Okay.
very concerned about the response I received from you and also from your colleague from the House. Because if anyone should have an intimate knowledge about this data, and that's why we vote for you, it should be you guys.
Oh, thank
Apparently,
you. Okay.
doesn't
Senate
know
House, Senate concerns.
what is completely wrong, and that is alarming for me as a citizen. So I would want to
Okay.
know why Senator his last name is not about the true numbers.
Okay. And is there anything else, sir? I'm going to go in a meeting soon. I do have your name and number, and then I will let your senator also know that you called our office with some alarming concerns regarding the statistics on the vaccines, correct?
I would like to know it from your senator because he is the head of the
Okay.
health committee. Okay.
Okay, great. Let me go get some, find some answers for you, and then I can give you a call back.
Okay. Thank you so much.
Thank you. All right. Have a wonderful day. Bye.
Aloha, Representative Imani's office.
Yes, hi, good morning. My name is Jürgen Steinmetz with ETN. I called you earlier and you responded to my phone call in regards to the count of tourists not being included in our daily COVID count. Is this you who left me this message?
Yes. So that was what we were told from Department of Health.
Okay. Now, see, this is where the confusion is. And I'm sorry, just I tried to reach out to a number of people. Who do you represent? I'm sorry.
We are the chair of Health, Human Services, and Homelessness Committee.
Okay. Now, if you are this, so why is your response 180 degrees conflicting with the response I got from you after I talked to you from the Department of Health Media Relations? I'm really getting confused. If you guys don't know it, who in the hell would know this?
It would be Department of Health. This is what we were told.
Okay. Now,
so we don't do the count. We don't know anything about the count. Our office doesn't take care of that. So all the
Okay.
information that we get is from Department of Health.
Okay. Now, if you get you probably have a lot better source in the Department of Health than I would have. So let's assume your number is right. Then we have an issue, and that's the next step. If we have an issue, we don't know how many tourists actually have COVID. And if this number is not included, we may be looking at something completely different here than what we're looking at every day, what is misleading every citizen who lives here. And that becomes a political issue again. So, I'd like to know what the reasoning behind this, if you were correct with what you're saying, we may have thousands of tourists coming here with COVID, what I don't assume, but it could be, right? We don't know. So how safe are we and how safe is our tourism industry? Now, if you look at similar jurisdictions like the Seychelles, like Cozumel, Mexico, where there's a similar problem, just look it up. You will get the response. So that's something I think you as or your representative as the department, head of the health department should be extremely concerned. But what I'm more concerned of that there is no straight answer. When I talked to 3 different people in our legislator, in our CDC, City of Honolulu, everyone has a different scenario. Why is it so difficult to get a one-time answer and a correct answer? Your answer, I can tell you, is alarming. It's 180% different from answers I received from others. So that's why I'm very concerned.
Okay. I mean, this is what I'm getting. This is what we've gotten from Department of Health. This is back a while back ago. I'm not sure if they changed it. We weren't aware of anything, but I can follow up.
Well, I didn't ask you to change old data. I asked you to change new, current data. And that's what we meant to publish also. Okay, so if I refer to you and you're giving me data or something what was weeks ago or months ago, this is a fast moving situation. You know, that is very confusing, and I would expect as someone an elected official to give me correct information and not assumption. So maybe if you can double check and let me know, I would really appreciate it.
Okay, I'll ask the department to contact you personally.
Hawaii Lodging, this is Ellis. How can I help you?
Yes, hi, Alice. My name is Jürgen. I'm calling from WTN, and I'm wondering if you can help me out. I have a very simple question, I think, and this is in regards to statistics.
Okay.
The Department of Health is bringing out in regards to COVID for Hawaii. Do these statistics, to your knowledge, do they include visitors? Because residents of Hawaii that are in another state are counted under Hawaii. Does it mean visitors in Hawaii that fell ill or have COVID positive diagnosis are falling under their home state, or are they included in our numbers?
It depends where they got tested. So if they got tested here, whether they are from here or not, they are considered in the count, and it'll say that. So for instance, if someone tested and was negative, but ended up testing positive a few days later after returning home, they release that in the data from the daily JIC. I can't remember what they call it.
Okay.
I gotta think about it. But so basically, wherever the test ended up being positive, it's reflected in the numbers.
So the number, we get like the numbers, we have 100 new cases, they include visitors.
If they tested positive here, yes.
Okay, all right, okay. Yeah, obviously someone tested positive elsewhere wouldn't be able to travel here. So
Right.
yeah, okay. Okay, that's all and I'm really glad you know this. I can tell you I've worked on this, talking to the Department of Health, Governor's Office, mayors, elected officials. No one had the answer you have, so congratulations.
Yeah, understood. Yeah, it's difficult. There's a lot of information out there.
Yeah, I appreciate it. Thank you. Bye-bye.
Okay, thank you.
Moriwaki's office. To accept this call, press 1 or not to connect call.
Hi, good afternoon. This is Jürgen.
Hello, Mr.
Hello.
Steinmetz. Hi,
Yes,
hi.
speaking.
This is Venus from Senator Moriwaki's office. How are you?
Fine. How are you doing, Venus?
Great, thank you. So just wanted to get back to you on your question about if a person has a driver's license that's from a different state, and how are they counted if they do contract COVID or if they do pass away from COVID. And so I did call the Disease Outbreak Control Division of the Department of Health, and they told me that because cases are changing as far as the developments of them. So, like if a person does have an out-of-state driver's license, they may not be counted um, in um, in the state. Let's see. Let's try to word it here. They would
Right.
be counted in the Hawaii because they don't know yet. The investigation has not been conducted. So if a person has contracted the virus or has passed away, they are counted in the initial count of in Hawaii. If an investigation happens after that, uh, they and they find that this person is from another state, then they won't be counted. And so the numbers are changing, and so if you'd like an answer as far as are they counted in the Hawaii counts, I asked her, and she said yes, they are. Um, but if there's more information that comes out of it, and they find out that it's not a resident, then the number adjusts in the count. And so weekly, the counts are weekly, right? And
Right.
so they will adjust that accordingly, the number accordingly. And so to answer your question, uh, I would say yes, they will be counted because they do. Um, if but if if it's found that they're from another state, then of course it won't be counted, and that will be reflected in the following week's count. And so I'm not sure. Does that make sense on your end?
Well, let me just try to rephrase this and see if
Okay.
I'm correct. So
Okay.
let's say there is a visitor. He goes to get tested because doesn't feel well. So he
Mhm.
then is tested positive, and this
Mhm.
visitor, so he would be included in the daily count on that day. But
Yes.
now then, when a week later or a few days later, it's determined that this is a visitor who doesn't live
Mhm.
in Hawaii, then
Yes.
it will be deducted again.
Yes. That's correct. That's
That's
correct.
very interesting.
Yeah,
That's very
because
interesting because see,
mhm.
I'm sorry.
Sure.
No,
Yeah, so they do have to report the cases when they do find a positive, and so of course it has to be recorded in the count. And so when they do contact tracing and they do more investigating, and then if it's found that it's from another state, the person is from another state, and there's more information that comes out, then the count is changed, of course. So, but yes, that's correct. That's correct. Mhm.
but wouldn't that be um, not only misleading? I mean, wouldn't that be?
Mhm.
I mean, I'm a little bit stunned with this type of the way this is
Mhm.
handled, because
Yes.
when we're a state where we rely on the travel and tourism industry, it is
Yes.
very important for our visitors and also for our
Mhm.
residents to
Mhm.
understand how safe tourism
Mhm.
is functioning in the state.
Mhm.
Hawaii has praised itself to have the best and lowest numbers in COVID for quite some
Mhm.
time, and probably
Yes.
and rightfully has the most strictest measures. I can tell you, I'm right now under quarantine, even though I had the vaccine, I had the shot, but it was done in Mexico because I went to a conference in Mexico. So I have 4 more days to go, and
Mm.
I don't mind. We're all responsible, and we all want to make sure everyone else is safe.
Right.
But
Mhm. Mhm.
what I don't understand is if these numbers are hidden from the public, there is no really count on how bad or good the visitors industry is in regards to bringing
Mhm.
COVID into the state, because these numbers, yes, they're initially added and then they're
Mhm.
taken
Mhm.
away again. So I think this
Yes.
would be completely misleading the tourism industry,
Mhm.
wouldn't it?
Yes. I understand how it would be viewed as such, but I think it's not that the information is hidden. It's just that they haven't found out any further information, and it's something that just has to. I mean, it's not like you get a case and then there's nothing further. That there's some fact finding that follows, and it's just a matter of time. And believe me, I think the Department of Health is trying as fast as they can, but I guess because it's an ongoing process, and it's hard to um, uh, kind of get a count because it's so dynamic. It's not something that's just set. It's there's always the COVID is always changing. It's always yeah, affecting people in different ways, in faster ways and slower ways, and the everybody's at their different stage of of the vaccine. If they have it, they have different stages within. It's just so dynamic, and it's hard to pinpoint uh, accurate. It's hard. It's like a somebody running in motion. It's hard to get statistics on somebody that's running in motion. Same like the virus. COVID is so dynamic. It's always changing. Each person is in a developmental stage if they do have it, and I guess the only um, thing that changes is, I mean, the only thing that stays the same rather is if the person dies, and then that's it. There's nothing left.
Right.
But right, yeah. So it's not so much that it's hidden information or that they're keeping anything up. It's just that they're trying as fast as they can to get the numbers and accurate numbers for the public, and as much as they can. And so the numbers that they do report in the news, I think, is as accurate as they can possibly be at that point in time. And we have to rely on. I mean, there's nothing else to rely on, and it's something that it's quite important, and it is changing, so it's hard to kind of pinpoint
Yeah,
accuracy.
and
There's so many dimensions of the virus. Hmm.
yeah, I
Hmm.
mean, to give you an example, let's say you have someone who contracts COVID while they're here visiting.
Hmm.
Obviously, they would not. I wouldn't assume they would let them go on the plane and go home with COVID, right? So
Hmm.
that hopefully is out. So they have to stay here, and hopefully they're going to feel better and be able to get home.
Hmm.
So when they get home, then their case is literally washed out here locally because they're now back
Hmm.
home. They're okay.
Hmm.
Are they not added anywhere, or they're going to be added again in their home state, or they're writing it out and then they vanish from the statistics? It's really confusing.
Yes, I'm not sure how. It would depend on. I'm not sure how they count in other states, or what their protocol is. But
That was very helpful. I really appreciate it. I'm sorry, I didn't get in the beginning. I know I talked to you before. What your representative? What's the
yes,
name of?
Senator Moriwaki. Mhm.
Oh, Senator Moriwati. Okay,
Yes.
okay.
Mhm.
Very
Mhm.
good.
But I appreciate your call, Mr. Steinmetz. Thank
No, I
you.
appreciate your response. Thank you. Take care.
Thank you. Aloha. Bye bye.
Aloha. Bye bye. And here you heard it from the nice representative for Senator Sharon Moriwaki. I really appreciated her call back, but to be honest with you, the response was eye-opening. I think her response was truthful, and it reflects in several of the other responses that were not really clear but kind of had the same message. Tourists and visitors are not included and have never been included in our overall count for COVID. This is interesting information. Maybe you would interpret it different. Maybe the health department had another explanation. But until then, we wish you a nice evening, good day, and aloha from Hawaii.